Welcome to the OptaHealth Choices seminar. Thank you for joining us. What is OptaHealth Choices all about? It's all about the illness-wellness continuum. In this seminar, we're going to answer the question, is health a matter of chance or is health a matter of choice? The truth is, health covers a wide spectrum of measurable positions, from poor health and the beginning of disease to good health and high-level wellness. Most of us reside in the comfort zone. But this comfort zone is really a false sense of wellness, and it gives us a false sense of security. Could you think you are healthy when really you're not? What truly determines your health? We assert that your position, and more importantly, your direction of movement on the illness-wellness continuum is much more a matter of choice than chance, which is why we offer OptaHealth Choices, because your health is your choice. But how do we measure it, and where do we even look? If you feel sick, you get a medical exam to look for the source of your disease and hopefully cure it. Even if you're not feeling sick, you may want to get a health risk assessment so you can detect any risk factors and get early intervention, treatment to protect your health, or at least slow down the process of disease. But what if you want to feel really good and not have to worry about getting a disease? In that case, we suggest the OptaHealth Index, where we look for optimal health. And if we don't find it, we figure out a way to get it and keep it. So where are you on the illness-wellness continuum? And more importantly, in what direction are you moving? So let's figure out what is the best approach for healthcare. The following 3 scenarios will serve to illustrate each of these different approaches. In scenario number 1, we will consider the medical exam, where we look for disease. Do you have any medical diagnoses? Are you taking any prescription medication? Do you take any over-the-counter medication regularly? Are you suffering from dementia? Are you being treated for cancer? Have you had a heart attack or stroke? Are you on insulin for diabetes? How severe is your chronic pain? Are you addicted to drugs, alcohol, or tobacco? How severe is your depression? Are you suicidal? Do we need to up your pills to help with your anxiety? Are you running low on your pain meds? In this first scenario of looking for disease, if you answered yes to any of those questions, that's too bad. We'll order some tests, get some labs, and adjust your prescriptions accordingly. If you answered no to all those questions, that's wonderful. You have a clean bill of health. Keep doing what you're doing. Really? Sure, things could be worse, and they will be soon enough, but is health simply the absence of disease, or is it something more? Can you know if you are developing a lifestyle-related chronic disease? Let's consider the next scenario. Scenario number 2, the health risk assessment, looking for risks of disease. You've gained some weight. Your blood pressure is a little high today, and your blood sugars are up again. You might be getting diabetes. Your cholesterol is going in the wrong direction, too. This looks more complicated. You might be developing metabolic syndrome. Any new aches or pains? Well, you are getting older. Are you still smoking? Maybe we should get a chest x-ray. Have you cut back on your drinking? We'll add liver function tests to your next blood draw. Have you had your follow-up colonoscopy? Now, did your father die from colon cancer? Or was it a heart attack? He was about your age, right? Okay. It looks like you're hanging in there so far, but we'll follow up with those tests, and we'll let you know. Don't forget your vaccine booster on your way out. That was not encouraging. Have you been there? Just waiting for disease to happen? Hoping you get a few more good years? Is that where you want to be? Isn't there something you can do to optimize your health and avoid disease, disability, and despair? and a premature death? Now let's consider the last scenario. Scenario number 3, the OptaHealth Index, looking for optimal health. Congratulations! 1 year now as a non-smoker. And you gave up alcohol too. Your wife and children must be happy about that. Great, you dropped another 10 pounds. Eating right, exercising every day, sleeping better, and your labs are all back to normal. So we can discontinue your last prescription. You tapered off all those quickly. What are you doing with all your extra energy? Now that's more like it. I'm taking my grandkids fishing again next Sunday. It's a fact. No matter where you are on the illness-wellness continuum, you can start moving in the right direction today just by developing a healthier lifestyle, making better health choices, and sticking to it. It's simple and effective. So, what do you believe? Is your health more by chance or more by choice? Yes, of course, by choice. It's been proven over the centuries, but most of us have forgotten this fact. The following are a few quotes from prominent historical figures to remind us. Hippocrates, the father of modern medicine, said way back in 440 BC, "Let food be thy medicine, or else medicine shall be thy food." Hippocrates also shared his discovery on how to stay healthy when he said, "Walking is a man's best medicine." More recently, but still over 150 years ago, Ellen White, an author and Bible scholar, said in 1868, "A walk in the open air every day, summer and winter, would be more beneficial to the health than all the medicine the doctors may prescribe." A little more recently, but still over 100 years ago, Thomas Edison, the scientist and inventor, said in 1923, "The doctor of the future will give no medication, but will interest his patients in the care of the human body, and in his diet, and in the cause and prevention of disease." 75 years ago, Albert Schweitzer, a medical missionary to Africa, said in 1948, "The doctor of the future will be oneself." But what is being said today by healthcare providers in 2024? Sorry, your health plan doesn't cover that. If health is a matter of choice, then your health is a matter of your choice. It's your responsibility. So, where do you want to be on the illness-wellness continuum? Well then, go for it. What are you waiting for? We're here to help. Living an optimal lifestyle will bring you optimal health, high-level wellness for all the joys of life.